Ranking Member Conyers has to go to a committee vote, so he has deputized me to step in and MC. And then that means that I get the distinct pleasure and privilege of introducing Public Citizen President Rob Weissman. Rob.
Let's give him a hand.
Many roles you can fill.
You know.
Thank you very much. Our country is too great, too strong, and too rich not to do what's right, not to provide health care coverage to every American as a matter of right. Now, when you couple the fact with what's right, with the fact that doing what's right will save hundreds of billions of dollars a year, it should be a no-brainer that we move forward with an expanded and improved Medicare for all system. But it's not a no-brainer, right? It's not a no-brainer in Washington. It has nothing to do with the evidence, with the merits, with the cause of justice, with the core commitment to basic rights, with the need to provide people with care from the day they're born to the day they die, irrespective of income. It has only to do with political power. As we celebrate the 48th anniversary of Medicare today, we see that grand program itself under attack. Not by those who say, let's strengthen it, let's weed out the incremental privatization that's weakened it, let's make sure we don't needlessly subsidize the big pharma drug companies. Not by those people, but by those who say we should make this program weaker, more privatized, less coverage, more co-pays, higher eligibility age. That's not going to happen. What is going to happen is that the American people are going to demand that we move forward, first to protect the system we now have, and to expand going forward. Which raises the question, well, is this realistic? Is it realistic after the passage of the Affordable Care Act to talk about a single-payer Medicare for all system? This is what we know is going to happen after the Affordable Care Act is implemented. However well it goes, whatever hiccups it has, two things are sure to happen. One, millions of people are going to remain uncovered. In the best case scenario, millions of people will remain uncovered, which means thousands of people will die every year from a lack of health insurance coverage. The second thing we know is that the private insurance companies are going to maintain control of our healthcare system. And we know that that means that costs will remain spiraling. Costs will continue to go out of control. So it is the realists who call for a single-payer system. It is the realists who say the time is coming sooner rather than later. If we want to cover everyone, the realistic option is single-payer Medicare for all. If we want to cost control, the realistic option is single-payer Medicare for all. If we want choice of doctor for everyone, the realistic option is single-payer coverage for all. If we want to have preventive medicine, the realistic option is single-payer Medicare coverage for all. It's going to take work to get there, but we are going to get there. We thank the members of Congress here today for their leadership, Mr. Conyers, Mr. Ellison, Takano, Senator Sanders, Mr. McDermott, longtime leaders and new leaders who are going to help take us where we need to go congressionally. We know it's going to take grassroots organizing. We thank our friends in PNHP, Healthcare Now, and the others on this side and on this side who are going to drive this forward. We're going to use traditional organizing. We're going to organize the doctors. We're going to organize the citizens. We're going to go online. We've got, we got the Twitter thing going with single payer. And we are going to succeed. The day is coming much sooner than the 48 years we're now celebrate for Medicare's existence when we will indeed have Medicare for all. Thanks very much.